Hello, my name is Laura and I am a nursing student. Today I will be demonstrating how to perform an indwelling catheter insertion while implementing general principles and safety practices. First, I am going to go and check my medical orders, and then I'm going to go to my patient's medical chart and I'm going to check and see if there are any physical limitations when it comes to my patient. And I am also going to check for patient allergies. Then I am going to gather my supplies for this specific task. And once I have gathered my supplies, I'm going to go see my patient. First, I will perform hand hygiene and I will put on any kind of PPE that is required for this specific patient. First, I'm going to identify my patient using a two-patient identifier. And I'm also going to check to see if she is wearing a allergy bracelet. And I'm going to ask the patient if she is allergic to anything. Specifically for this procedure, I'm going to ask her if she is allergic to latex or iodine. And the answer is no. And I'm also going to ask the patient if she has ever had a catheter before. And if she has not, then I am going to explain the procedure and I'm going to open the floor up to any kind of questions she may have. And I'm also going to ask her again if it's okay if we begin the procedure. And she says yes. So first I'm going to put on some gloves. Now I have already raised the bed to a good working height for my height. And I'm going to raise this bed to about elbow level. And I'm also going to perform this procedure on the right side of my patient because I am right-handed. Now while doing this procedure, we want to remember to conserve the patient's dignity and their integrity. So first we're going to pull down the blanket. And like we did previously, we check their medical chart to see if there's any kind of physical limitations. And we're just going to double check that verbally with the patient. And we're going to raise the patient's legs and bend at the knee. And we're going to have the patient's feet about 2 feet apart from each other. That'll give us plenty of space. And we're also going to make sure that the knees fall abductly to the side. Now, then we are going to put a chucks pad under their bottom. And we're going to ask the patient if they can raise their bottom so we can place that chucks pad underneath. Okay, great. Now next, we're going to perform pericare. So we will have gathered hot soapy water and some towels for drying. Now it's important to grab your washcloth, and as you perform pericare, you want to use a different section of the washcloth between each different stroke. So first, you take your washcloth and you want to start from top to bottom wiping. So you want to start at the top of the orifice and then wipe down to the sacrum, and then change to a new position of the washcloth and wash in a different section from the top of the orifice to the bottom of the sacrum, and then change position on the washcloth and go from top of the orifice to the bottom of the sacrum, and then you want to rinse in the same manner and pat dry. And then we take off our gloves and throw them in the trash can. I have a trash can right here underneath my bedside table, and we want to perform hand hygiene. And this is when we will begin our sterile procedure, setting up our station. And we will set it up right here on the patient's bed. Okay. Now the next step will be donning my sterile gloves. And with this procedure, everything is sterile with the exception of the outside and 1 inch around the border. So with my dominant hand, I will take a glove and put it on my non-dominant hand. I'll take a step back. Okay. Now I'll go for my next glove, and I will reach down into the pocket, take a step back, put that glove on. Now I'll go back to my other glove, and now I am sterile. I will go back to my patient, give myself a little room. Okay, and I will set up my sterile field. I don't need these. Here are my swabs. Okay, first I'm going to attach my 10 cc syringe. Okay. I'm going to attach this very snugly, and I'm just going to very carefully take the sheath off of the tubing, making sure that it doesn't fly everywhere. And this goes in the trash. Okay, now next I'm going to take my lubrication and I'm going to squirt it in the tray. Squirt, squirt, squirt. Throw it in the trash. Okay, next I am going to take my non-dominant hand and I'm going to use my thumb and my forefinger, and I am going to put it on her, right above the meatus on the major laboris, and I am going to open that just a little bit because we are going to take the swab sticks and we are going to clean the meatus in the inside. And we're going to go around and we're going to clean the minors from top to bottom, and then we throw away. We'll grab another one from top to bottom, and then we throw away. And we grab another one. This time we're going to go down the middle, making sure that we get the meatus. And we're going to go from top to bottom, getting that meatus. And we're going to throw away. Now I'm not going to I'm not going to move my left hand. It's going to stay right there. Now, I'm going to take the tubing and I am going to dip it in the lubrication, lubricating 1 to 2 inches from the tip. And I am going to hold the tubing 2 to 3 inches from the tip. And I am going to begin insertion into the meatus. And after I start inserting 2 to 3 inches, I should start seeing urine in the clear part of the tube. And during this part, I should be very careful that my glove does not touch the outer part of the meatus, the majora, the minoris, any part of the outer part of the female vagina. Now, if I feel any kind of resistance, that's when I ask the patient to take a deep breath and I push 2 to 3 inches more. Now, the urine appeared in the tubing after inserting the first 2 to 3 inches. That means I insert 2 to 3 inches more to ensure that I have it in the bladder and not the urethra. So after 2 to 3 more inches, I grab the tube with my non-dominant hand and I keep it right there in place. I insert all of the 10 cc of saline to form a balloon inside of her bladder. I throw away, and then what I do is I tug to make sure that I have proper insertion. Now at this point, I am going to take off my sterile gloves. And I'm going to perform hand hygiene. And I am going to put on a pair of clean gloves. Next, what I'm going to do is I am going to place the tubing on the inside of her thigh and I am going to attach it. I'm going to secure it right here on the inside of her thigh, and I'm going to make sure that there is a little bit of play right here, a little bit of lax. And then I am going to take her catheter bag and I'm going to make sure that I place it below the flow. And I am going to place it on the side of her bed And I'm not going to place it on the side rails. I'm going to try to find a J hook or an S hook, something that doesn't move, something that is going to keep that bag under the bed. Now, if she has an order that requires a urine sample, what I'm going to do is, down there on the floor, I am going to open up her port, and I'm going to get that urine sample. And then I'm going to make sure that I close that back up. Next, I'm going to clean up my area. I'm going to ensure that the patient is comfortable. Cover this patient back up. I'm going to ask the patient if the patient needs anything, something to drink, something to, just anything. And I'm going to perform hand hygiene. And I'm going to report and record. Now, if for some reason my patient had the physical limitations to where they could not lay there with their legs bent at the knees and their knees recumbent, then they could lay in the left lateral position with their right knee bent up. So, thank you for watching. Hope you have a great day.